Hello everyone, welcome to MedTech World. Today I have the pleasure to be with Mr. Salim representing Fujifilm. Thank you very much for being with us today.
Thank you for receiving me.
So let's talk about what's the solution of Fujifilm.
Actually, we're here today representing Fujifilm. Fujifilm is one of the big Japanese conglomerates, especially dealing with healthcare for the last few years. Because Fujifilm at the beginning, as you remember, it was just about like film and photography. But since some few years now, we're really focusing on healthcare. So we are here only for the endoscopy part, but we also represent the CT MRI part, radiology part, IVD part, laboratory part, and also the EUS system that we have. So today we're very interested to collaborate with AEM, which was London, and now it's in Malta. So we're very happy in Malta City to show our latest technologies in endoscope.
How are you finding the industry in Malta? You have a big background as well. You're based in France. And how is this ecosystem in Malta?
Yeah, I find Malta very impressive. It's very international city, although it's very small, but it's open to three continents. As you know, Malta is very central. So it's between like Europe, Africa, and Asia. So the location of Malta makes it like a, let's say, a melting pot for all these industry startups, and like the doctors, the hospitals, and all the healthcare infrastructure is getting better, better, and better. And getting the AEM to be done in Malta, which is one of the most prestigious international courses, is a very big achievement, I think. And it's a very big leap forward toward achieving this Malta healthcare ecosystem, let's say.
Indeed, yes. Mr. Salim, earlier today you had a panel discussion. So let's talk about this.
Yeah, the panel discussion, I put as a title for the panel discussion, listening to clinicians. Because, you know, as we are an R&D company and we're delivering products, and these products are for treating patients. But who is treating the patients? It's not the engineers, it's not us sales guys or marketing guys, it's the HCP or the healthcare professionals. So my panel was about listening to these healthcare professionals, how to treat these patients better. So we don't need to start on a scratch book or on a sketchbook or on in an R&D like lab or R&D facility. We need to start by listening to these partners, let's say, or clinicians, because they know what is best for the patients. And by having this like collaboration with these physicians, we can go to develop products that can help the patients better.
Indeed. How do you see clinicians actually moving towards innovation? How are they welcoming the new technologies we are seeing today?
Yeah, you know, clinicians usually, especially gastroenterologists, they come up to become a gastroenterologist after around 10 years of studying everything. So I think these are the most people open to innovations, especially in healthcare. You know, some minimal invasive techniques, some new AI techniques are very much welcomed by doctors. Of course, there are some doctors who are afraid of change, who are afraid that sometimes the AI especially can take their role in this ecosystem of healthcare. But like with a doctor who's doing therapeutic, who's moving to something else, he can give some part of his job to the AI. So I think they're very welcoming to the new technologies and new techniques, especially what is AI, let's say.
Our MedTech World community is very global. So talking about going global, what are the plans of Fujifilm in the next 5 to 10 years?
Yeah, like I said before, Fujifilm is available in almost every country in the world. We have like either direct or indirect representative in around 190 countries in the world, because we went from film, you know, and during I'm a little bit old now, but during my early days, you know, we had these photography films. Whenever you go, you can see these photography films. So we use this large network to be available everywhere in every and each hospital. So our plan is like to think local and act global. So we have a global idea about how healthcare is going, especially that the world is becoming smaller and smaller now. So I saw last time on YouTube or on the internet, and we were also involved because we have something called Synapse 3D for 3D modulation of surgical anatomies. One doctor was in Bordeaux because I handle France. He was making an operation in Bordeaux and the patient was in China. So 8,000 kilometers away. So we cannot escape from this globalization. So we need to act in this global figure. So Fujifilm in the next 5 or 10 years, we're more of a global company, let's say.
Indeed.
Yeah.
Thank you very much, Mr. Salim, for being with us today. And we extend the invitation for MedTech Malta this year from the 12th till the 14th November. Thank
you.
you very
We're
much.
gladly joined. Thanks a lot.